The tertiary hospital environments offer multidisciplinary teams, so you're working alongside the consultants, the registrars, the residents in the medical world, as well as then the physiotherapists, the dietitians, speech therapists. So it's a large team environment, so you get that opportunity to be a part of that, which is great, depending on which ward you're working in. I spent a lot of time in the rehabilitation ward as well as the oncology ward. So that influenced, I guess, your experience that you have in that hospital environment. I did a lot in the bone marrow transplant ward, and so that really is a different clinical life there when you're dealing with life itself and having patients who may be there one day and the next day that you go in, their bed's being cleaned and they're no longer there. So, it's not all about just repairing, a splint to help somebody, mobilise again after a broken limb. I think it just exposes you and your maturity, I guess, to all those other experiences in life that, possibly you're not really exposed to beforehand. So I wouldn't trade my hospital experience for the world. I loved every minute of it. I think it really helps to shape the therapist that you are, having that injury experience of knowing what happens in that environment and what the culture is like. Even now, if I have to speak with a doctor, I know I would never be fearful of calling up the main hospital line and asking them to page them. And I guess that's from that familiarity of experience of working in those environments and knowing, that you may not speak with the consultant, but you possibly will get the registrar, and if not, you'll get some, unsuspecting resident that may or may not know the patient. So I think, it definitely helps build on that knowledge base after university, which gives you that academic knowledge, but the hospital really gives you that practical knowledge, which I think is worth gold. Hands-on procedures really depends on what ward that you're working in. You may be making a splint for somebody who had a fracture in their thumb and working with a thermoplastic type fabric where you're having to melt it down and mould it to get an optimal functional position for the hand. You may be looking at managing edema or swelling by looking at bandaging or prescribing pressure garments for somebody. So you'd be measuring them and getting the garment made up from one of the companies to help manage edema or swelling for that person. In rehabilitation, you could be working with someone who's had a stroke and has developed hemiplegia where they're not able to use one side of their limb, and you're trying to assist them to get back to normal life and manage things like cutlery and use a computer, or how do they write if it's not their dominant hand. So I think occupational therapy is such a broad scope, and it's often very difficult to define it to one particular thing, because based on the injury it really influences your treatment process to that person. And it may be hands-on, that you're trying to facilitate someone who has got chronic pain to reuse their hands in kind of a normal movement pattern, or you could be just providing advice or education on how to pace themselves around the home once they've had a heart attack or something like that. So it just depends on the area that you work in, so it's really hard to just identify one particular thing, I guess.